So this video is for Cherie Olivia Anandananda. On Google Plus, she asked your thoughts on this, and she was pointing me towards a blog, and I will link to that blog article in the description box. Read it first. Here's 3 seconds. 1, 2, 3. Okay. It's a very short blog. And she wants to know about my thoughts on the practice of kicking someone out of treatment for addiction problems because they proved their diagnosis, meaning they used a substance while they were in treatment. And while I can see the argument, and I actually talk with other counselors who are all treat, no matter what happens. The flip side of the argument from treat is maintain boundaries. So what the article doesn't talk about, first of all, the rates for administrative discharge are it's statistics, and that doesn't reflect the reality that I have seen in treatment programs. In fact, it does not anywhere mention how you could be administratively discharged from a treatment program where there's no use allowed into a detox facility and then recycled back into your treatment. You could also be sent to an emergency room first, then to detox, then to your further treatment. So a lot of these discharges that you're seeing are just one step in the process. You have to see in addiction treatment that relapse is a fact. You know, it's going to happen. A certain percentage of your people are going to relapse. And when they do, they don't just get discharged, out of the program. Many times you can't see, based on their records, where they went, based on their reported records. But if you were to look at their entire chart and look at all of their ins and outs from the same treatment program, you might see that they've been recycled a lot through hospitals and detoxes. You don't see that. And that might make an extremely high number of administrative discharges, but they're coming back to the same treatment, or they're being sent to where they need to be at that time. And that's just not something that you can really dig out of those statistics that are being used in this blog article. Boundaries. You have to maintain boundaries in treatment milieu. If you are in a lockdown facility where nobody's supposed to be using at all, then when you find somebody that's using, depending on the severity, you need to do something. You need to gown and search everyone who's in the treatment. You need to search the whole premises to find all of the drug. You can't even trust them to turn it in. So you need to do all of that. Keep your facility clean, but also there has to be some sort of consequence. And if you're just looking at what's best for their treatment, yes, sometimes discharge from that setting is the best. There are people who do not benefit at all from certain treatment settings, especially when they can find ways to get around the rules, such as sneaking out at night with their ploys to get out of the facility and get back in and bring drugs into the facility and substances into the facility. A very big problem is when one person brings substances into a facility like that and then shares with others, because they're undermining everyone else's program. And so that one person that brings it in needs to be dealt with harsher than those people that, they were there for treatment and they got pushed to right there in treatment. Another thing that I don't see reflected in this blog post is the greatest reason for administrative discharge against staff advice. The greatest reason across all treatment programs that I have been a part of. It is the client left against staff advice because he could not smoke. That's it. They consider smoking to be a right, and in order to get paid, you have to uphold certain certifications and certain boundaries to be a treatment facility. One of those being, if you're a medical facility, you can't have smoking on the property. So, since you can't smoke on the property and people want to smoke, and they feel like it's not even an addiction, even though tobacco kills more than all the other drugs put together, they feel like it's not going to help them because they need to work on one thing at a time instead of work on everything, which, there's even studies on, you should address things right away. There's people who feel like if they have to quit heroin and they're also forced to quit smoking at the same time, that they're not going to be able to quit their heroin. And I hear reasons. People give me reasons all the time that they should continue to use whatever. I get reasons all the time. I argue with people all the time about that. Yeah. Many times people's reasons go against all of our evidence to the contrary with scientific studies and basically the clients or patients, they always want to have it their way, many times in certain treatment facilities, the clients are mandated to be there, and instead of treatment, they would rather sit down and watch TV or suck up all the nice sugary snacks that are put out for them, rather than go to group therapy, and so they get mandated to go to the groups when, of course people have emotions throughout the day and they might not feel like going to the group, but if it's a treatment program whereby in order for the treatment program to get paid by billing, Medicaid or their insurance, they have to prove that that client went through so many hours of treatment through a week. If that client is not willing to go to that many hours because they'd rather sit around and watch TV or sleep, sleep all day because they are detoxing, well, then what do? If you're a treatment program, if someone wants to sleep through all the groups, you got to discharge them, if you can't get them to go to the groups. And you can tell them flat out, look, if you miss 2 more groups, you're out of here, and then they miss another one. You tell them, you miss 1 more group, you're out of here. We can't keep you here if you're not going to participate. And then they continue to sleep, and they say, well, you're going to kick me out for withdrawing, and they'll throw guilt on you. This whole blog article will throw guilt on me for kicking someone out administratively, but I've had guilt thrown on me like, so I've got to lose my job and my family because you don't want me to be here because I broke a little rule, because I'm withdrawing. It makes sense that I would withdraw coming to a treatment program. the program is what it is, and if you can't make it through for whatever reason, you can't make it through. Now, again, when someone gets administratively discharged, it doesn't have to be to themselves out in the community with nothing available to them. Many times they get discharged to a different treatment modality, like detox. And then they'll get recycled right back into the same facility that they were in before and have to start everything all over again to try to make it through that program. Yeah, it's a very big fight about boundaries and rules. I've had to, because of treatment centers that I've worked in, I've had to send someone back to prison basically because they did not follow the rules and they brought a cell phone into treatment. And in some treatment milieus, you're not allowed to have cell phones. Why? Because they want your attention, because your calls have to be monitored, because people will order up from their friends, just like pizza, they will order up heroin. They will order up whatever drug they want. They will call their mom, and their mom will deliver a pack of cigarettes to them, you know. And we can't be having that, you know. Over a cigarette. I have seen someone get discharged from a program that if they did not complete, they would be going back to prison. Over a cigarette. You know? And hopefully, when that person made it to prison, there were more treatment options available to him than just being faced with all of the distractions of the community and all of the distractions of their home life. You know, hopefully they could concentrate on the rest of their treatment while they were in prison. I don't see that happening because even there, you don't have to go. You know, you can order a bed and say, hey, I'd like some treatment, and then, you know, the next day you're like, I really don't want to get up out of my cell. And that's what happens. There's not a lot motivating people to get treatment if, you know, as far as the carrot and the stick, there's not a lot of stick that's very effective. You know, the carrot is you get to live the rest of your life without being hooked on drugs. And if people don't recognize that as, you know, the goal, then they're going to break a whole bunch of rules. You know, they're not going to work towards writing their life. They're going to work towards, what do I feel like right now? So, yeah, I think that addiction counselors and therapists should not be another arm of law enforcement, even if law enforcement's paying the bill for that person to be there. I don't think that counselors should report directly to law enforcement. Many times when someone gets kicked out of a treatment facility that they were mandated to be there by their parole officer, they get the opportunity to tell their parole officer themselves why they're leaving treatment. You know, you call your own parole officer. You know, use whatever language you want to explain the fact that you used in treatment. You know, and tell your parole officer where you're going from here, where we're sending you, where your referral is to, and tell him this is just, you know, part of your process. I think it would be wrong if we, you know, immediately reported right to the parole officer, hey, you know, this guy used some heroin, and it was at this time and this date, and we have this drug test to prove it. You know, that would be complete breaks of confidentiality there. So I don't think it would be right for us to enforce the law basically. I think that boundaries in treatment are different than law proper. I don't think that we are, as counselors, supposed to be representative of the law. We're supposed to be representative of treatment. But even treatment, if it's not working, you have to recognize that it's not working. One of the principles of like NADAC and SAMHSA and basically any ethical board, one of the principles that they follow is when you're making a judgment as to placement for someone's treatment, you have to place them in the appropriate place, and if they're not getting anything out of that treatment, then you have to diligently get them out of that and into something that will work or could work. And if you don't, and you leave them in that treatment modality, and you continue to bill for them being there, even though they are completely undermining their own treatment, then that's an ethical violation on your part. How ethical would it be for me to just say, nobody's made any progress this week, so that we could just keep them an extra week and just bill Medicaid for, another $1 million, because nobody in this facility really seems like they're making enough progress for us to not get $1 million from Medicaid. That would be completely unethical. You have to realistically and truthfully say, is this person benefiting from this treatment? Are they making progress? And you have to set a boundary of how long do we want to continue this treatment, and how long will it benefit this person. And once they finish, they finish. And you test them in the next stage of their life. So yeah, there will always be arguments against kicking someone out of treatment for doing exactly what they're there for treatment for. But boundaries. That is the argument against this blog post that you sent me, Cherie. Boundaries.